Well, good morning, everybody. How we doing? Spectre here for another edition of Midnight Rider, the morning edition here today. Got a good broadcast for you going on here this morning, as promised, and as I talked about on previous broadcasts. I'm going to get into the mask business. To mask or not to mask? cV-I9 update is the title of today's show. The latest update on the masks. We're going to get into the tyranny side of things, the policy, the pushback, the science, and health all wrapped into one. So you'll want to stick around for this one. We're going to have a good show on this. Stick around. We'll see you back here momentarily on the other side. Warning. These social media platforms may be hazardous to your health. Censorship kills. Pain coming. This has been a PSA by Breaking Spectre. Alright, welcome back everybody. How we doing? Good to have you aboard. Good to see everybody tuning in. Got a few of you guys on the YouTube side. One of you is over on Twitch. A few of you over on D-Live, and of course our friends over at the old Tiger Network joining here this morning. Appreciate you guys tuning in. As I alluded, today's broadcast is going to be on the mask side of things, and nothing but the mask, much like the last time where I focused on the vaccine side of things. Like I said, we're going to carry these forward and kind of break them down into the respective bits and pieces underneath this umbrella known as this whole COVID-19 tyranny that has been foisted upon us. That being said, I've got a little bit of a montage, I guess is the best way I would describe this. Took a little bit of doing, that's why the little bit of delay over the last couple of days of trying to get this sorted out, pieced together. So what I think I'm going to do, I think I'll play this thing through for the first time. It's a little over about 7 minutes in that, where we'll, bang through about 80 articles and that on the quick. And I'll narrate through some of this, but I think what I'll do on the back end of the broadcast after I get through some of the articles, the most important ones that I feel at least anyway, is I'll let this thing play through once again, maybe unnarrated. So maybe that's the way I'll do that here this morning. So that being said, let me just get into it here, and away we go. Alright, so a little bit of a worldwide look at things here. We're going to bang across the world on this. And of course, the first we're going to see is out of New York. We're going to go over to New York sends mask squads to enforce social distancing in twos. And these are backed up maybe about the last couple, 2, 3, 4 months in that here. So you may recognize some of these. And then, of course, we'll head over to Wisconsin, Michigan area. Some of the stuff that has been going on there. Of course, Whitmer in the news. And then, of course, we'll head over to Idaho, what has been going on there, a little liberty seeking there. Idaho mask burning party, breathe easy. Montana ends mask mandate on Friday, a little freedom going on there. And of course, a walkout planned by students in Kalispell up in Montana, and even Ammon Bundy got wrapped up in this. Then we'll head down to California, what has been going on with old Newsom and company. Judicial Watch uncovers documents behind a $1 billion mask deal. All that good stuff. And of course, majority of Americans wear a mask in public. Some of the stats behind that, and a family kicked off a flight for not forcing their 4-year-old autistic son to mask up. And of course, a little political humor. It's like wearing your underwear, Senator Paul says. And of course, Marjorie Taylor Greene in the news. Over to Arizona, bill would give businesses a choice to not enforce the coronavirus mask update, wearing, etc. Then We'll head over to Texas for a slew. Of course, everybody recognizes that Abbott and that had just released the mandate, but we had a 65-year-old net get knocked down. More of the same in regards to Texas and Abbott ending the statewide mask mandate. Tasing man for not wearing masks. Still in Texas, Texas AG threatens Austin with lawsuit for not complying. And of course, Texas continues downward trend of COVID cases, hospitalizations, etc. Up over to Oklahoma. Oklahoma schools to begin charging a fee to students who don't wear masks. Over to Alabama. Alabama governor extends mask order. We're not there yet. Over to Florida. Despite no lockdown, mask mandates, Florida has the same hospitalization rate as 2018 flu season. And a little bit more out of Florida. Tampa mayor threatens police investigation after Super Bowl fans who didn't mask up. All that garbage that took place here a little better than a month ago. Even CPAC affected. And of course, what would we be without a little judicial tyranny on top of it? New York City judge removes 6-year-old from mother because she didn't mask. Mother pleads for help. And of course, one more judge who ripped children from no-mask mothers recuses himself after National File report. And of course, even heading over to China during the pandemic, China sent millions of counterfeit masks and test kits. And that kind of rounds out the U.S. from that perspective. Now let's head over to Europe. And we'll get into the UK. So out of the UK, we had an Irishman sentenced to 2 months in prison for failing to wear a mask. And who can forget the guy who was lit up inside the grocery store? Over to Germany, of course, and we got the German state forbids drivers from wearing masks, sunglasses, and hats all at the same time. A couple others there. And of course, we've got a Jewish family kicked off a flight over maskless baby. And of course, even the Czech police tackling folks. And of course, now down to the alphabet agencies. Obey the alphabet agencies because they know best. CDC and everybody else. Of course, TSA to slap mask mandate violators with $1,500 fine. CDC begins recommending wearing 2 masks. CDC and TSA form federal mask police. Then we get down to Biden's 100 days of mask transforms into masks through the next year. CDC issues order that makes not wearing a mask on public transportation a federal crime. Of course, all American and travelers are threatened to wear masks and can be ordered to take them off as well. CDC now says Americans should wear masks indoors. Oh, and while you're commercial fishing too. And of course, Fauci, CDC claims mask mandates don't have statistically improved impact. COVID, no masks. And of course, Kerry. And of course, because the experts, what they tell us on TV. Doctor tells NBC Americans should consider wearing 4 masks, 2 masks, whatever, however many masks. And of course, Dr. Paul Offit wants masks for life. Embarrassing former Surgeon General and COVID expert confronted on COVID, can't answer questions. And what would we be without some Fauci's follies? Fauci, useless Americans, take the vaccine. The masks need to stay on. Flip-flopper here. And a little bit more out of Fauci. Fauci warns it's possible Americans will still be wearing face masks for, quite a period of time. Fauci, those vaccinated must continue to wear masks to protect others. And now the science. And this is where the bulk of today's show will focus on the actual science, not the pseudo-fakeness of what we see in the Mockingbird Media and Company today. So some of these I'll just let kind of play through because we will hit a few of these, not every single one. And so there you have it, kind of a whirlwind tour around the world. And so now we'll actually get into the ones that I described here, the ones on the actual science, the ones that are probably the most important for people to come up to their own conclusions on. So I'm going to walk through, like I said, I'm kind of dating myself back about the December time frame. No particular reason why that time frame to pick upon, but obviously I've got a lot more in the whole archives that go well beyond that, dating back to when this whole thing started last year, but just an arbitrary thing. Nonetheless, let's pick it up with natural news. It says that asymptomatic COVID-19 spread isn't real, so why are people still wearing masks? And this was from December 14th of last year. And it says, after more than 9 months of hysterical fear-mongering about healthy people supposedly spreading the Wuhan coronavirus asymptomatically, science has confirmed that asymptomatic spread of the novel virus is not actually a real thing. So, why, then, are we still being told that healthy people need to wear a face covering when out in public? A new peer-reviewed paper published in the Nature journal takes a closer look at the 300 asymptomatic positive cases of the Chinese virus that were identified in Wuhan, China, where the virus originated. These 300 quote-unquote cases were the only ones deemed to be asymptomatically positive among the more than 9 million citizens who live in Wuhan. Researchers found that among these 300 quote-unquote positive cases, not a single one of them spread the virus to any of their family members, friends, or other close contacts. All of them were found to have no viable virus inside their bodies, according to lab cultures that were taken as part of an in-depth analysis, meaning there was no virus present to be transmitted. So a total of 190 asymptomatic samples tested positive for antibodies, the IgG and or IgM, suggesting either a recent positive COVID-19 infection or a false positive PCR test, which we've covered ad nauseum here on this channel and several others. The latter scenario is the more likely one, seeing as how PCR tests produce false positives more than 97% of the time. Remember that figure, folks, 97% of the time. PCR tests, false positives. Scientists identified and followed 1,174 close contacts of the asymptomatic cases and found that none of them tested positive for the Wu flu. This led them to conclude, in essence, that asymptomatic spread of COVID-19 is fake news, just like many have been saying all along. This study confirms what physicians have known and non-scientists have suspected for millennia, namely that asymptomatic transmission has never been the primary cause of outbreaks, says Dr. Simone Gold, MD, the founder of America's Frontline Doctors. And of course, we've seen how much of her work has been censored online. It's time to take off your masks, America. Sweden, which has never imposed lockdowns, mandatory mask wearing, or any of the other nonsensical and draconian measures that have been forced on American society, responded to the study's findings with no surprise at all. Based on the experience of COVID-19 and other similar diseases, the assessment is that the spread of infection from people without symptoms accounts for a small proportion, reported the Swedish Public Health Agency. This is actually too nice of a response because it implies that asymptomatic carriers actually exist and can, in exceptional circumstances, still spread disease. We know from the study that this is not the case, as asymptomatic, aka healthy people, cannot spread something they do not actually have. Let me repeat that line. We know from the study that this is not the case, as asymptomatic, healthy people cannot spread something they do not actually have. With that said, there is absolutely no reason to continue forcing healthy people to block their breathing holes with made-in-China plastic or fabric. Not only is this forced intervention medically useless, it is also harmful and unnatural, serving no purpose other than to make scared people feel safe. Any state and local government still trying to force people to wear masks are completely out of alignment with science. In other words, as they continue to push snake oil woo-woo as the cure for the woo-woo flu, the same goes for stores like Costco that no longer honor medical exemptions to mask mandates, which is a violation of the Americans with Disabilities Act. This study dovetails with the Danish mask study, which found that wearing a mask does nothing to stop the spread of the Chinese virus. My right to not wear something does not end where someone else's fear begins, is how one Epoch Times commenter making an excellent point about how fear should never be used as an excuse to trample other people's health freedom. And of course, Natural News has got pandemic.news, where you can find a lot of great info. That being said, let's continue. Out of News Wars back on December 21st. Do mask mandates work? New analysis suggests they don't. According to analysis by data expert Justin Hart, who has been following the COVID-19 data for months, demonstrated in a Sunday Twitter thread that states with mask mandates had a greater number of COVID cases per 100,000 people than states without mandates. Here's the thread. Justin Hart breaking this down from December 20th of last year. Breaking. Do mask mandates work? Our analysis below. We look at cases on days where mask mandates were in place versus when they were not. We calculated the cases per day adjusted per population, and with the mask mandate, 27 cases per day per 100,000 people. No mask mandate, 17 cases. So here we see the infographic from May 1st, December 15, with and without, no mask mandate, 17, with mask mandate, 27. Continuing on, says that's right, with mandates in place, states say 10 more cases per 100,000 population. Here's a breakdown by state. Many states have had days with mandates, blue, and without, orange. Draw your own conclusions. And I won't open that up, but I'll go ahead and drop the link out there if you want to check out the actual thread. You guys can check that out. And for upload later on, I'll go ahead and put all the links in that here as well. Justin Hart continues, says, Team Apocalypse will object and say, well, states which put mandates in place were seeing surges in cases. Perhaps, but our data shows that even after the mandates went up, it did nothing. Hashtag to our friend at IANM5C, or SC rather. Here we see the case of California and Florida, where obviously California had the draconian measures and Florida largely remained open with DeSantis and company. Justin Hart continues, says another objection. Well, we can never know for certain how much worse it could have been without masks. First, that's not science. That's unfalsifiable nonsense. Maybe consider that the virus is beyond your control. See these 6 states with different mandates up and down. And of course, like I said, you'll be able to check out the thread inside there. Another objection, well, maybe people aren't really wearing masks. We have you covered there. Here's then an interactive tool allowing you to drill down on county-level COVID cases mapped to a New York Times survey on how people are wearing masks. And he continues, says, we also have numerous articles and studies demonstrating that mask mandates are not justified and that recent items cited by the CDC do not present strong evidence at all for mask mandates. So a couple other good links right there. It says our main purpose here is targeting elected officials who use masks as a distraction from bad lockdown policies which dramatically impact society. Until these politicians abandon those tactics, cases up, masks harder, we will continue to fight this. More from Ian. It says from October 23rd, so I looked, 3 counties in Florida allowed mask mandates to expire by 10/23, so I looked at all 67 counties in Florida with and without mandates to see what had happened since. Well, this is a huge surprise. The counties without mask mandates have lower case rates and lower case growth. And again, if we're looking purely at PCR cases that have a 97% false positive, what good is that data? Bad data in, bad data out. And while there were some objections to Hart's analysis, such as whether there might be bias towards getting tested for mask wearers or regional differences in population density, many of the replies to Hart's thread support his findings. And of course, here we go back through the thread again. Response to that says Spain's serologic survey shows those always using masks got infected 25% more than those never using it. 3.8% of the full accomplishing mask users and 3.9% of the partial users were infected versus 3% of those never using it. Official Spanish data published, but OC never aired. Yeah, well, it's 0.8, 0.9%. That's pretty much negligible, so it's pretty much break even. Another response, Kyle Lamb says, Justin asked if I could add these. Apparently the research was extensive to Florida as well. Here's some additional work done by the RG folks. And a hypothesis. Kevin McKernan says it's an intuitive hypothesis. Since the mask doesn't kill virus, it just collects them, reversing your natural defenses of expelling virus with large droplets that hit Earth. The mask accelerates evaporation through capillary action, making smaller droplets to allow deep inhalation. In effect, the masks are a viral trampoline, making the virus exponentially more infective and reaching deeper into more thrombotic tissue, basically down into your lungs. Some evidence Kansas jumped on this trampoline in the summer. You can translate the German intro. There we go. But maybe the CDC, who Dr. Fauci and the Surgeon General were right in February when they said masks don't work. On the other hand, they're so useful for other things. So there you go. A little bit of a breakdown. Again, you've got the link out there. You guys can check out the data within the thread there. Continuing on, getting into January now, Natural News had this article. Says real life study. Masked school children are harmed physically, psychologically, behaviorally, and suffer from 24 distinct health issues. So it's not just us, folks. If you're of age, 21 or above, adult, it's affecting kids as well. This is a first-of-its-kind study involving over 25,000 children reveals that masks are harming school children in many physical and psychological ways and have a negative effect on their behavior, focus, and interest in learning. These negative effects are censored from social media, underreported by the media, and ignored by government officials. Of the 25,930 children studied, the database includes at least 17,854 health complaints submitted by parents. So I guess quick math on that, 17 to 25, I'd say that's pretty close to 70-75%. Says these health issues and impairments were observed in approximately 68% of masked school children who were forced to wear a face covering for an average of 4.5 hours per day. So the prolonged, forced, strict mask wearing destroys the health of children. The registry, established on October 20th, 2020, asked 363 doctors to inform parents and teachers that they can report the health impacts they are witnessing from prolonged mask use of children. The health issues were exhaustive and included irritability, 60%, headache, 53%, difficulty concentrating, 50%, less happiness, 49%, reluctance to go to school, kindergarten, 44%, malaise, 42%, impaired learning, 38%, and drowsiness or fatigue, 37%. So basically, just about every 4 in 10 and higher had some level of complaint. Says nearly a third of the children sleep worse than normal, and a quarter of the children had developed new fears. Hundreds of children were less cheerful, less playful, and most were unusually irritable. Even more concerning, almost 30% had shortness of breath, 26.4%, experienced dizziness, and hundreds of children suffered from feelings of weakness, a feeling of disease, accelerated respiration, tightness in the chest, and short-term impairment of consciousness. Universal mask wearing is destroying the health of children, making their immune system more susceptible to disease. Masking of school children is a medical experiment that should be a parent's choice and require informed consent. How much of what we have done so far over the last year of this experiment has been by way of informed consent? Maybe disinformation and propaganda through the TV, radio, and everything else, right? Says around the world, fathers and mothers are losing their parental rights as asinine medical interventions are mandated on their children in the school setting. Children are being psychologically raped as adults force them to believe that their breath is a constant source of disease transmission, that they have a moral duty to ensure that their diseased breath never infects another person. Apparently, we've gotten away for hundreds and hundreds and hundreds and thousands of years without problem, but now it's a problem. Children are being trained to fear one another, to fear the world around them, and to quiver in obedience to authority and medical fraud. Will these institutions be held liable for the physical, psychological, and behavioral harm they continue to impose on children? Teachers and counselors who are required by law to report child abuse are now actively participating in the abuse of children and bullying parents to comply. Every day, authorities turn a blind eye to the psychological harm they impose on children with mandatory masking of each child's mouth and nose. What else can be forced onto children under the guise of keeping everyone, quote-unquote, safe? Masking of school children is a medical experiment. Mask manufacturers have not conducted independent studies for long-term use of their products on adolescents. Therefore, parents are not given informed consent so they can make a choice that is best for their children. In most cases, the schools are dictating what parents must do to their child's body, setting unlawful precedent that tramples on the medical privacy rights of the family while perpetuating institutional abuse of children that is liability-free. There are no manufacturer-independent studies on the use of masks for children and adolescents that are certified as medical products for occupational safety in professional applications, the study authors stated. In addition, due to the unknown materials used, there are no findings on the potential protective effects or side effects of the often homemade everyday masks worn by the majority of children. In view of the ongoing measures to contain the COVID-19 pandemic, and in particular the varying obligations for children and adolescents to wear masks in school over a long period of time, there is an urgent need for research. So again, the science in this particular case is definitely not settled. Alright, so over to American Institute for Economic Research back on January 19th. The empirical case for a mask mandate lacks scientific grounding. This is last fall. The University of Washington's Institute for Health Metrics Evaluation, IHME, published a headline-grabbing study with a politically appealing claim. If Americans would simply mask up when they ventured out into public, over 120,000 lives could be saved by the beginning of next year. As Joe Biden takes office later this week, he is widely expected to use executive orders to enact a 100-day-long national mask mandate. Biden's action is directly premised on the claims of the IHME study, which he has repeatedly alluded to in his public commentary. But is the science behind this claim sound? As I documented last fall, the IHME's projections rested upon a simple data error. The IHME model begins from the assumption that only 49% of Americans were currently wearing masks in public. Increase the mask adoption rate to between 85 and 95%, it stands to reason, and you'll save over 100,000 lives by reducing the spread of COVID-19. A national mask mandate, the authors implied, would do the trick. And I guess I'll pause right there real quick, because if you saw the montage net that I went through, shortly after we went through California, we went down to a quick little graphic that showed the mask wearing amongst at least Americans here was north of 80% and has been since probably about May or June, maybe a little bit sooner if I'm recalling the graphic correctly, since May or June of last year. So again, they're absolutely right that they're using a false assumption. The IHME's projections had a crucial problem, however. The IHME took its 49% adoption figure from a months-old outdated survey at the beginning of the pandemic. As of late September, when they made their projections, U.S. mask adoption hovered at 80% nationwide. There we go. Says instead of nearly doubling mask use rates, a national mask mandate would only increase compliance by about 5 to 15 percentage points. The number of lives that the mandate would save, it turned out, had been vastly exaggerated in the published report. Shocker. Exaggerated, huh? My science. The IHME's director took exception to my criticism, though notably he did not dispute any of my math. Magnus is correct that our estimate of mask-wearing rates has increased. Since the study's publication, explained Christopher J. L. Murray in a letter to the Wall Street Journal. New data from the summer and early fall confirmed an increase in public mask adoption rates, yet Murray continued. He is incorrect to suggest that this weakens the case for public policies that require masks. In the roughly 2 months since the public exchange, the IHME's mask model has undergone a curious transformation. Murray and his team quietly updated their figures to reflect the higher and more realistic mask adoption rates. Furthermore, they extended these corrections retroactively to their model's projections from the summer months. The chart below shows how the IHME mask model has shifted over time. The blue line depicts the actual U.S. mask adoption rate, as tracked by the YouGov survey. It shows that U.S. mask adoption rapidly increased in the spring until hitting about 80% in mid-July. From July until the present, it has held stable at the 80% level. And then we got the parallel surveys by the CDC, Pew Charitable Trust, Carnegie Mellon University, and the Kaiser Family Foundation confirm these findings. The orange line shows the IHME's mask model and forecast on September 21st, which is the version it published in the journal Nature Medicine. The yellow line shows the IHME's subsequent upward revision as of January 2021, which are now finally starting to converge with reality. Their estimates still fall slightly short of what the aforementioned survey shows. But as of January 18th, the IHME model assumes that 76% of Americans wear masks in public, just shy of the 80% level. And here we see the depiction there. It says, while the IHME team is to be commended for correcting their model to better reflect reality, these adjustments also mean that comparatively few additional gains remain to be had from bumping the mask adoption rate upward to 85 or 95%. The most recent of the independent surveys, a study conducted by the Kaiser Family Foundation in December, even reports that 89% of Americans always or almost always wear masks in public, suggesting we are already at or near the targeted universal adoption threshold of the IHME model. Says the ongoing corrections to the IHME model have severely dampened the promised benefits of a national mask mandate. The figure below shows the IHME's lives saved, quote-unquote, forecast under universal mask adoption with 95% compliance, as projected for 4 months out from its release date. And here we see that. Says back in September, the IHME model projected over 120,000 lives would be saved by January under a mask mandate. Now it projects a much smaller 31,000 lives saved by the end of April. So a pretty good revision downward. When reading these ever-shrinking projections, keep in mind that the U.S. mask adoption patterns have not meaningfully changed since the midsummer of 2020. Before the IHME even released its first lives saved estimate. It has stayed constant at roughly 80% throughout this entire time. The only apparent changes are the input data for the IHME model, which they updated in the wake of my critique to better approximate reality. The effect is to reduce the IHME's lives saved projection at the 4-month mark to only 1/4 of its headline-grabbing claim from back in the fall. These changes do not mean that masks lack effectiveness at the margins. They remain a precautionary hygienic response, particularly in certain indoor venues and around vulnerable people. Rather, the IHME's model adjustments confirm what several of us have been pointing out since the mask mandate movement began in earnest last year. The main gains from masking have already been reaped. Americans rapidly adopted them last summer and have continued to use them at consistently high rates ever since. Adding a new national mask mandate on top of this practice will bring little, if any, additional benefit to what voluntary adoption already achieved, though it may foster a false hope in the exaggerated claims of an obsolete and erroneous model. So there you go. Quick little study in that regard. Obviously, all these models and that, you remember back to the early ones that we heard how many people would die and that out of the UK, things of that nature, which were obviously erroneous from the start. Bad data in, you get garbage in, garbage out. That's the old mantra, right? And this was the same. At least they had the heart to go back and revise. Did they go ahead and recant their previous statements? I don't know. I can't say whether or not, but at least they did the right thing and adjust the data. Out of NBC News, millions of counterfeit N95 masks distributed to healthcare workers in the U.S. So, let's pontificate a moment here. Let's say that everybody masks up. We get the N95 masks, which, by the way, on the side of the box says, does not protect against coronavirus. But we feel better, right? What happens if you've been all this time wearing this mask and all of a sudden you find out this bit of information? What happens? Masks imitating the real thing are flooding U.S. ports, and authorities can hardly keep pace. And again, this is out of the Mockingbird Media NBC News here. Back in February, it says thousands of counterfeit 3M respirators have slipped past U.S. investigators in recent months, making it to the cheeks and chins of healthcare workers, and perplexing experts who say they're not vastly inferior to the real thing. N95 masks are prized for their ability to filter out 95% of the minuscule particles that can carry the coronavirus. Yet the fakes pouring into the country have fooled healthcare leaders from coast to coast. As many as 1.9 million counterfeit 3M masks made their way to about 40 hospitals in Washington state, according to the State Hospital Association, spurring officials to alert staff members and pull the masks off the shelf. The elite Cleveland Clinic recently acknowledged that, since November, it had inadvertently distributed 3M counterfeits to hospital staffers. A Minnesota hospital made a similar admission. Nurses at Jersey Shore University Medical Center in Neptune, New Jersey, have been highly suspicious since November that the misshapen and odd-smelling 3M masks they were given are knockoffs. Their concerns fueled because mask lot numbers match those the company listed online as possible fakes. And it says people have been terrified for the last 2.5 months, said Daniel Hayes, a nurse and union vice president at the hospital. They felt like they were taking their lives in their hands, and they don't have anything else to wear. According to 3M, the leading U.S. producer of N95s, more than 10 million counterfeits have been seized since the pandemic began, and the company has fielded 10,500 queries about the authenticity of N95s. The company said in a January 20th letter that its work in recent months led to the seizure of fake 3M masks sold or offered to government agencies in at least 6 states. After Kaiser Health News sent photos of the masks the New Jersey nurses had questioned, a 3M spokesperson referred to them as the counterfeits you identified. So testing the fakes. At KHN's request, ECRI, a nonprofit that helps healthcare providers assess the quality of medical technology, agreed to test the masks that sparked the New Jersey nurses' concern. Tests of a dozen masks showed that they filtered out 95% or more of the 0.3 micron particles they expected to catch. ECRI Engineering Director Chris Levanchi said several healthcare organizations across the U.S. have recently made similar requests for tests of apparently fake 3M masks that the company warned about. Levanchi said that the results have shown similarly high filtration levels, but also higher breathing resistance than expected. He said such resistance can fatigue the person wearing the mask or cause the mask to lift off the face, letting in unfiltered air. We're kind of scratching our heads trying to understand this situation, because it's not as black and white as I would have expected, Levanchi said. I've looked at other masks we knew were counterfeit, and they usually perform terribly. 3M spokesperson Jennifer Ehrlich said a critical feature of N95 masks, aside from filtration, is how well they fit. Without proper seal and fit, respirators are not filtering properly. Gaps could allow air to enter, Ehrlich said by email. The materials management team for Hackensack Meridian Health, which owns the Jersey Shore Hospital, is working with an independent lab on validating the quality and compliance of specific lot numbers of 3M N95 respirators the company identified as potentially problematic, according to a company statement. When the Washington State Hospital Association purchased 300,000 N95s in December, it sent samples to hospital leaders who said they appeared legitimate. It's not like we just ordered them sight unseen, said Beth Zabrowski, spokesperson for the association. We had 2 major medical centers in Seattle look at the quality straps, cut them open, and decide this looked like it's a real deal before they bought them. So, you get the idea here. The bottom line is that, yes, there are knockoffs out there. No real way of knowing what you're getting on shelf unless you're going to, is the average populace going to go by lot number back to 3M and see if it's legitimate, or are they just going to slap the thing on their head to get around some ridiculous mandate that their state, county, local store or whatever requires them, and then probably pitch the sucker? That would be my guess. All right, well, over to Scientific American says masks can be detrimental to babies' speech and language development. This also back early part of February. Says, my daughter's friend was recently alarmed when she was told that her 2-year-old must wear a mask in preschool. Her little girl already struggles to make herself understood, and her mother worries that the mask will make it harder for her daughter to be understood and that she will have trouble telling what her masked peers and teachers are saying. Now that the face mask has become the essential accoutrement of our lives, the COVID-19 pandemic has laid bare our fundamental need to see whole faces. Could it be that babies and young children, who must learn the meaning of the myriad of communication signals normally available in their social partners' faces, are especially vulnerable to their degradation and partially visible faces? Faces are a complex and rich source of social, emotional, and linguistic signals. We rely on all of these signals to communicate with one another through a complex and dynamic dance that depends on each partner being able to read the other's signals. Interestingly, even when we can see whole faces, we often have trouble telling what other people are feeling. For instance, as the psychologist Lisa Feldman Barrett has noted, we can interpret a smile as meaning I'm happy, I like you, or I'm embarrassed. So, seeing partially visible faces robs us of a plethora of linguistic signals that are essential for communication. Babies and young children see and hear communicative signals and learn to attach meanings to them through their everyday interactions with their caregivers and social partners. Take, for example, a baby at a birthday party or in a daycare center where several masked people can be heard and seen talking. To figure out which face goes with which voice, that baby must learn that the mouth is a source of spoken language and that looking at the mouth is essential for figuring out whether a particular person's face goes with a particular voice. We wanted to know whether and when babies might discover the importance of a talker's mouth. So, in one study in my lab, we showed videos of talking faces to babies of different ages and tracked their attention by using an eye-tracking device. We discovered that babies begin lip reading at around 8 months of age. Crucially, the onset of lip reading at this age corresponds with the onset of canonical babbling, suggesting that babies begin lip reading because they become interested in speech and language. By lip reading, babies now gain access to visual speech cues which, as Janet Worker and her colleagues at the University of British Columbia have shown, are clearly perceptible to them. So, the lip reading now enables babies to see the visible speech cues that they need to figure out which face goes with which voice. Of course, babies cannot access visible speech cues if others are wearing masks. Importantly, our discovery of lip reading came from a study of only English learning infants, and so we were not sure if this was a universal behavior seen in babies learning any language. To answer this question, in subsequent studies with my collaborators, Ferran Pons and Laura Bosch at the University of Barcelona, we examined Spanish and Catalan learning infants' response to talking faces and found that they also begin lip reading at around 8 months of age. Intriguingly, we also found that bilingual Spanish and Catalan learning babies lip read more than their monolingual counterparts, indicating that bilingual babies rely more on visual speech cues to help them keep their 2 languages apart. Crucially, once lip reading emerges in infancy, it becomes a default mode of speech processing whenever comprehension is difficult. This is illustrated by our latest studies in which my Spanish colleagues, their graduate student Joan Berules and I found that 4 to 6-year-old bilingual children lip read more when they are confronted with speech in an unfamiliar than in a familiar language. Similarly, we found that adults who are expert second language speakers lip read more than their monolingual counterparts when presented with speech in their second language. These findings are consistent with other evidence that adults resort to lip reading when confronted with speech in noise, accented speech, or foreign language speech. Overall, the research to date demonstrates that the visible articulations that babies normally see when others are talking play a key role in their acquisition of communication skills. Research also shows that babies who lip read more have better language skills when they're older. If so, this suggests that masks probably hinder babies' acquisition of speech and language. Of course, the news is not all bad. Babies spend much of their time at home with their unmasked caregivers. It is only in daycare or when out and about with their parents that they don't see whole talking faces. Therefore, it may only be these situations that may have long-term negative consequences for babies. We need more research to tell us if this is the case. In the meantime, how can we ensure that my daughter's friend's little girl will, at a minimum, understand her masked peers and teachers? The best advice is that, when outside the home, we should follow CDC's guidance and always wear a mask. In contrast, when home and unmasked, we should engage in as much in-face communication with our babies as possible so that they can see and hear our talking faces in their full splendor. Practicing the latter will ensure that babies' young brains, which are highly adaptable, will have the opportunity to compensate for the perceptual deprivation that they experience outside the home. So there you go. And of course, it should probably come as no real surprise that obviously wearing a mask that covers 2/3 of your face probably robs anyone of trying to figure out just what exactly somebody on the other side is speaking, feeling, kind of reading the cues, things of that nature. All right, well, over to American Institute for Economic Research again. The CDC's mask mandate study debunked, and this recently back on March 4th. The U.S. Center for Disease Control and Prevention, the CDC, recently published a February 2021 MMWR report entitled Decline in COVID-19 Hospitalization Growth Rates Associated with Statewide Mask Mandates, 10 States, March to October 2020. This report focused on 10 sites that had been included in the COVID-19 Associated Hospitalization Surveillance Network. This CDC report describes a decrease in hospitalization rates of growth of up to 5.6% in adults 18 to 65 years old, and attributed this to the use of masking and/or the introduction of mask mandates in the various sites. These rates were compared to those obtained from a 4-week period of time prior to the introduction of mask mandates. In so doing, and by way of regression analysis, the reduced rates of hospitalization were attributed to the introduction of statewide mask mandates. Firstly, the initial publication by the CDC, February 5th through February 12, 2021, was plagued with important inaccuracies that were then, fortunately, addressed in an updated erratum, February 26. We applaud the CDC for taking the steps required to correct these errors. Reporting done by the CDC, which is generally considered as the premier public health agency in the U.S., must be of the highest quality, particularly since advice rendered by the CDC is also relied upon worldwide. In face, CDC's conclusion on mandates might appear to make sense unless one is familiar with the scientific data pertaining to the ineffectiveness of masking for prevention of the spread of COVID-19. And of course, there's a litany of references there. In which case, the findings, in fact, contradict most of what is now known. The CDC's conclusion might have made more sense if the real-world evidence we have about mandates did not actually exist. And again, a handful more references there. So does the CDC really think that masks prevent the wearer from getting COVID or from spreading it to others? The CDC admits that the scientific evidence is mixed, as their most recent report glosses over many unanswered scientific questions. But even if it were clear, or clear enough, as a scientific matter that masks properly used could reduce transmission, it is a leap to conclude that a governmental mandate to wear masks will do more good than harm, even as a strictly biological or epidemiological matter. Mask mandates may not be followed. Masks worn as a result of a mandate may not be used properly. Some mask practices, like double masking, can do harm, particularly to children. And even if a mask mandate results in some increased number of masks being worn, and worn properly, the mandate and the associated publicity may reduce the public's attention to other more effective safeguards, such as meticulous hygiene practices. Thus, it is not surprising that the CDC's own recent conclusion on the use of non-pharmaceutical measures such as face masks in pandemic influenza warned that scientific evidence from 14 randomized controlled trials of these measures did not support a substantial effect on transmission. Moreover, in the World Health Organization's 2019 guidance document on non-pharmaceutical public health measures in a pandemic, they reported as to face masks that there is no evidence that this is effective in reducing transmission. Similarly, in the fine print to a recent double-blind, double-masking simulation, the CDC stated that the findings of these simulations supporting mask usage should neither be generalized to the effectiveness nor interpreted as being representative of the effectiveness of these masks when worn in real-world settings. So that's like 3 strikes there right in a row, right? Just look at the data from Jonas P. Ludvigsen that is emerging from Sweden in children 16 years old and under when preschools and schools were kept open and there were no face masks through social distancing was fostered. The result was 0 deaths from COVID-19 in 1.95 million Swedish children across the study period. The number of infections was exceedingly low. The number of hospitalizations was exceedingly low. And there were no deaths, 0, in children with COVID-19. All this despite not wearing masks due to no school-wide mask mandate. Is this merely a perfunctory and legally prudent warning by the CDC that your mileage may vary? Or is it more likely that a hot mutual fund telling you that past performance is no guarantee of future results? What is the CDC really trying to say about face masks, and why so much confusion? We have reservations about the methodology employed and conclusions drawn in the CDC double mask study, which we will address in a separate discussion, but again, their disclaimer as noted above, the findings of these simulations should neither be generalized to the effectiveness nor interpreted as being representative of the effectiveness of these masks when worn in real-world settings. Seeds thought of doubt in relation to the value of this report. Why then would the CDC even bother to publicize these findings? What is the public health impact? What is the benefit? Moreover, the CDC even indicated in the double mask study that there are harms, an example, impediments to breathing, due to double masking. Indeed, the harms, and the many references there, are very real when face masks are used, yet are often dismissed and not even discussed by the media, medical establishment, or government bureaucrats. In relation to this, Dr. Anthony Fauci of the NIAID created appreciable confusion by initially suggesting and encouraging the use of double masks instead of one. Dr. Fauci then reversed his statements on the use of double masks. Dr. Fauci's advisories took on a form of doublespeak which has an appearance of randomness or worse, capriciousness. This can only distort the desperately needed advice by the public at large. Unsound advice can be very damaging on several levels. This random form of advice giving was not reflective of a single event. For example, while touting vaccines as the only way for society to emerge back to normal from the pandemic, Dr. Flip-Flop Fauci is now advising that in fact, even with vaccinations, people should still not attend public gatherings and restaurants, and that such restrictions could be in place until the end of 2021. While changes in advice are required when new data emerge, we hold that this was definitely not the case with respect to masking, or vaccination for that matter. Below are the main scientific shortcomings or analytical ambiguities in the CDC's most recent MMWR report on mask mandates. Number 1. The CDC's main evidence, a regression study based on selected sites in 10 states with masking mandates from March through October of 2020, did not include the 4-month period from November through February 2021, which might have controlled for other possibly contributing factors such as sunlight and vitamin D, and did not appear to take into account the possible effects of such factors as school closures or changes in social distancing practices. We point out that during this period of March 22, 2020 to October 12, 2020, this is actually representative of the spring, summer, and early fall seasons when outdoor activity increases. Of course, this leads to more exposure to sunlight with the attendant generation of active vitamin D metabolites, while at the same time there are marked reductions in confinement within enclosed spaces, which would necessarily reduce the opportunities for transmission of disease. A more stringent approach to the analyses includes the use of all available data, in effect not excluding a full 4-month period of time, might have led conceivably to a conclusion that there was in fact no significant effect of mask mandates on disease or case rates. And in concert with the CDC's disclaimers noted above, the CDC indicates in their own report that the conclusions described in the study in favor of masking were, at best, only moderately reliable. Number 2. The CDC analyzed changes in hospitalizations, but did not compare infection, disease, or death rates between states with and without masking mandates. Available evidence of that nature suggests that the course of the pandemic was not affected by state masking mandates. Number 3. The CDC used a least squared fit regression analysis, OLS, using X as mask wearing and the dependent outcome to the Y variable, which is the number of COVID cases, despite the fact that simple regression is not the optimal approach and, we believe, should be replaced with the orthogonal distance regression, ODR, which would yield more reliable findings. Number 4, based on the reporting, it appears that the CDC's regression analysis was based on data from limited sites within a state, and not the entire state. Oh, a little cherry picking, eh? Number 5, the CDC report failed to discuss recent potent research data based on high-quality, case-controlled analyses, as well as a high-quality Danish randomized controlled trial study published in the Annals of Internal Medicine, which found no statistically or clinically significant impact of mask use in regard to the rate of infection with SARS-CoV-2, or a recent NEJM publication, Prospective Cohort Charm Study, where researchers studied SARS-CoV-2 transmission among Marine recruits at Paris Island. Population size was 1,848, who volunteered, underwent a 2-week quarantine at home that was followed by a second 2-week quarantine in a closed college campus setting. The predominant finding was that despite the very strict and enforced quarantine, including 2 full weeks of supervised confinement and then enforced social distancing and masking protocols, the rate of transmission was not reduced and in fact seemed to be higher than expected, despite the strong experimental design and the rigor associated with carrying out the study. Number 6. The CDC report does not address and contextualize substantial real-world experience, showing that adding mandates where there is already substantial mask wearing has little effect, and that mask mandates that were followed can be correlated with increased case counts, and more references there. This obviously may not be cause and effect, but the same criticism can be levied against correlations or regressions going in the opposite direction. So based on the assessment of the CDC mask mandate report, we find ourselves troubled by the study methods themselves, and by extension the conclusions drawn. The real-world evidence exists and indicates that in various countries and U.S. states, when mask mandates were followed consistently, there was an inexorable increase in case counts. We have seen that in states and countries that already have a high frequency of mask wearing, that adding mandates had little effect. There was zero benefit of adding a mask mandate in Austria, Germany, France, Spain, UK, Belgium, Ireland, Portugal, and Italy, and states like California, Hawaii, and Texas. Importantly, we do not ascribe a cause-effect relationship between the implementation of mask mandates and the rise in case rates. But we also demand the same approach when it comes to claiming some sort of causal relationship between the introduction of mask mandates and likely claims by the CDC that their findings could support their implementation countrywide. We think that inclusion of such evidence on the failure of mask mandates globally and states within the U.S. would have made for more balanced, comprehensive, and fully informed reporting. Specifically, when we consider the evidence on mask mandates in states with a mandate in effect, there were 9,605,256 confirmed COVID-19 cases, which works out to an average of 27 cases per 100,000 people per day. When states didn't have a statewide order, including states that never even had mandates, coupled with the period of time states with mandates still didn't have a mandate in place, there were 5,781,716 cases, averaging 17 cases per 100,000 people per day. In other words, protective mask mandates have a poor track record insofar as fighting this pandemic. States with mandates in place produced an average of 10 more reported infections per 100,000 people per day than states without mandates. The blind acceptance of the current unsupported dogma has become so entrenched that if cases do go up, the experts wedded to the universal use of masks then claim that this is good news and infer that the masking mandate prevented even more cases from occurring. This is a fine example of tautology and defies reason. We are very troubled by this type of scientific reporting and inference, for it is based on assumptions, supposition, and speculation. Masks for the general population, as they are currently used, surgical masks and the cloth masks, are ineffective, particularly when used with other mitigation, and the body of evidence is clear. A recent op-ed in the Washington Post spoke to mask wearing by everyone during the 1918 flu pandemic with the conclusion that masks were useless. Let me repeat that. A recent op-ed, even in the Washington Post, spoke to mask wearing by everyone during the 1918 flu pandemic with the conclusion that masks were useless. We embrace fully the contention by Klumpus in the NEJM that what is clear, however, is that universal masking alone is not a panacea. A mask will not protect providers caring for a patient with active COVID-19 if it's not accompanied by meticulous hand hygiene, eye protection, gloves, and a gown. A mask alone will not prevent healthcare workers with early COVID-19 from contaminating their hands and spreading the virus to patients and colleagues. Focusing on universal masking alone could, paradoxically, lead to more transmission of COVID-19 if it diverts attention from implementing more fundamental infection control measures. We are particularly alarmed by the harms of masking and the failure by top U.S. agencies and leadership, as well as the media and media medical experts, to discuss or highlight harms in any discourse on masking. We end by imploring the CDC to take our critique in the spirit in which it was generated. We welcome continued rigorous scientific examination of these important societal lockdowns, school closures, and masking and broader mask mandate issues by CDC and others. We are entirely willing to consider any evidence that contradicts what we have seen, which suggests that societal lockdowns and school closures are not effective, and as presented here, suggests that mask mandates are ineffective. Most importantly, to maintain the validity of scientific research as a tool and the public's confidence in such research, reports on the results of such research should more comprehensively address the weakness or ambiguities that exist, as well as the conclusions the reporting agency supports. Treating the science means relying on the scientific process and method and not merely following the leader. It is not the same as trusting without verification. the conclusory statements of human beings simply because they have scientific training or credentials. This is especially so if their views and inquiry have become politicized. Dr. Martin Kulldorff of Harvard's Medical School has recently commented on the present COVID-19 scientific and research environment by stating, "After 300 years, the Age of Enlightenment has ended." Sadly, we must agree that it's not just the Age of Enlightenment has come to an end, but indeed that the science itself has been politicized and severely corrupted. So there you have it, a breakdown of one of the most recent CDC studies, which basically turns into a big nothing burger. And of course, out of World Net Daily government data shows masks had no impact on COVID-19 spread. This is a graph that overlays data from surveys on mask usage with the number of coronavirus cases, confirms studies that indicate the face coverings have no significant impact on the spread of the coronavirus. Using data culled from YouGov.com and the COVID Tracking Project from March 20th to March 3rd, 2021. There we go. Whole year. There we go. Economist Brian Westbury created the chart and posted it on Twitter. Surveys showed mask usage reached about 80% by midsummer last year and has remained consistent since then. During that period, however, the number of daily positive cases rose and fell precipitously. Many epidemiologists have noted the coronavirus in a second major wave is following the bell-shaped pattern of epidemics predicted by Farr's Law in 1840, regardless of mitigation efforts. And here we see the mask usage by versus daily positive tests. Again, the date between March 20th of last year versus March 3rd of this year. In blue, we see the daily positive COVID-19 tests, which it looks like as of about, maybe around the 23rd or 4th of January has dropped, as they said, precipitously. And the YouGov survey reported mask usage overlaid on top of that here. Again, highlighting back to maybe about June-ish time frame of last year, we've been north of 70-80% since then. Another chart from a Financial Times analysis of the COVID Tracking Project shows very little difference in the number of cases between North Dakota and South Dakota. That's despite the fact that North Dakota has had a mask mandate, while South Dakota has not. And here we see the delta between the two, overlaying the two states, and basically no real difference. On Tuesday, Texas Gov. Greg Abbott announced the state will open 100% next Wednesday and end the statewide mask mandate, arguing cases and hospitalizations have dropped precipitously. Vaccines are being distributed, and too many Texans have been sidelined from employment opportunities, and too many small business owners have struggled to pay their bills. Later Tuesday, Mississippi Republican Governor Tate Reeves announced he is replacing all current executive orders regarding coronavirus mitigation with recommendations. By the end of the week, at least 6 other states followed with significant moves. On Thursday, Alabama Republican Governor Kay Ivey extended her state mask order for another month, but said it will end for good April 9th. Connecticut Democrat Governor Ned Lamont said Thursday he will lift on March 19th all capacity limits on restaurants, retail stores, libraries, personal services, indoor recreation, gyms, museums, offices, and houses of worship. Arizona Republican Governor Doug Ducey on Friday announced all businesses will reopen at 100% capacity. West Virginia Republican Governor Jim Justice said bars, restaurants, small businesses, retail stores, gyms, and museums can open to 100% capacity. California will allow Major League Baseball and theme parks such as Disneyland to host live shows at reduced capacity on April 1st. Axios reported the Centers for Disease Control is allowing shelters handling child migrants to expand to 100% capacity, abandoning a COVID-19 requirement to stay at 50%. No statistically significant difference. Former White House coronavirus advisor Dr. Scott Atlas explained in a recent interview why widespread use of masks is ineffective as a public policy. And of course, here's his remarks.
Things like universal mask wearing, honestly, that is just completely contrary to the science as well as common sense to think that you must wear a mask when you're in the middle of a desert when you're in your car alone driving, when you're bicycling through, St. James Park. This kind of stuff is nonsense.
Would you not mandate masks anywhere?
Absolutely not widespread mask mandates. You can look at LA County in Los Angeles here, Miami-Dade County, many states in the U.S., the Philippines, Spain, France, the U.K., all over the world. Mandating masks for the population does not stop cases. That is just super naive, wrong, and just that's garbage science, really, and there is no science to support that. And the WHO does not recommend widespread mandatory masks. The NIH does not recommend that. The CDC data itself shows that doesn't work. So that's sort of bordering on wearing a copper bracelet, as far as I'm concerned. I do think that masks have a role, and that's in medicine. We wear masks for surgical procedures. And the reason you wear a mask is when you're very close to somebody or a sterile environment like an open incision, you want to stop a cough. You want to stop droplet from getting in and infecting something.
So there you have it, in the words of Scott Gottlieb there. We'll leave that there, and let's continue on to the last one here. A little bit out of order, but this one's fitting for the very end. It says, masks, social distancing, and virtual learning are really about the installation of communism in America. So think about that. Everything that we just covered here today, the things that we've covered in the past, over the last year, where does this all eventually lead? Has this all been smoke and mirrors cover for the Great Reset agenda? Consider that. Natural News had this, says everything about the new norm in America is modeled after communist China. Most Americans think it's all about protection from COVID-19, but that's just a cover story. Just like 9/11 was a cover story for the Patriot Act to enable the U.S. government to spy on every American and disable constitutional rights. Under a communist regime, the people are not allowed to have personalities, businesses, religion, healthy social interactions, or more money than each other. Everyone is poor, so everyone is the same, subservient to a tyrannical government that ends creativity, entrepreneurship, believing in God, speaking your mind, and printing opinions about the government. That's why COVID is the perfect front for the installation of communism in America. With masks on, we can't see each other's expressions, or smiles, or even have normal conversations. With social distancing, we are not united or organically working together. Instead, we are virtual. We eat GMOs. We are being genetically mutated with vaccines. And it can never be undone. The corporations are running small and medium-sized businesses out of business. And the plandemic is the perfect storm as the excuse, so Americans won't rise up and overthrow the regime before it's too late. What's the deadliest virus in the world? Communism. Has school for American children become nearly worthless? That's the plan, folks, coming down from the election-stealing Biden regime. Is there more friction at home now with everybody on virtual lockdown? That's the plan, folks, coming down from the globalist regime. Are kids literally attending school, sitting alone in their own classroom while teachers teach virtually from home on their computers? Yes, that is happening right now in America. It's about communism, not disease mitigation. Wondering why there's no flu going around this winter, only COVID? It's a plandemic, which means it was planned. Did you know communism has killed more people than famine, nuclear weapons, or disease? Communism is the deadliest virus in the world, and socialism is what spreads it. Socialism systematically eliminates the middle class. Citizens are either filthy rich or deadly poor. There's nothing in the middle. We're being trained, corralled, and ostracized like huge herds of cattle or sheep. The masks, social distancing, and virtual distance learning keeps us isolated and stripped from thinking as a group. No more planning for the peons. No critical thinking. We'll all be too weak, poor, and isolated from each other to rebel. That's what Hitler did with the Jews in the concentration camps. Then he put fluoride in their water. Sound familiar? America is under a communist umbrella right now. It's just not so obvious yet because almost everyone has bought into this pandemic narrative. It's fear-based rule, but get ready. Fear-based rule is underway in the USA, also known as the NPCA, New Pandemic Communist America. Under socialism, communism, nobody owns land, or their own business, or guns. Criticize the leaders or politicians in general, and you find yourself in jail with your organs being removed to be sold on the black market, one by one. Wondering why there's a fake race war going on, led by Antifa? Because upheaval convinces the masses to accept martial law for protection, and that is the end of our republic. All of social media, television news, and every newspaper is in on it. Sold out to communism, the new highest bidder. America is in debt about $25 trillion, and that's going up fast under the Biden communist regime. Mass inflation and skyrocketing interest rates are just around the bend, along with another housing bubble burst. This time, there won't be a recession. It will be a depression beyond comprehension. Get ready for very long food lines and forced vaccination at all jobs. Be prepared for mass surveillance. NATO police, communist mercenaries, drones, and robots controlling every metropolitan city. There was a Holocaust in Russia before Germany, in case you didn't know, and it was a very dark, cruel world. So realize and remember this: masks, social distancing, and virtual learning are really about the installation of communism in America. So, definitely something to consider, certainly, right? So that being said, that is going to round out the show for today. I think what I will do now, as I started off the broadcast kind of narrating through the assortment of articles worldwide, I think what I'll do here to close things out, in case you missed it, you're late joining, whatever, I'll go ahead and play that through again. This time I'll just let it play through on its own and not narrate. And if need be, I can go ahead and pull that out and make that a standalone, about 7-minute piece too as well. So that being said, here we go. All right, well, that is going to do it for the broadcast. I appreciate you guys tuning in. Again, there was no sound on that as we had gone through it on the front end of the broadcast here, but leave a note in the comments below if you want me to split that little piece out, maybe add some music or something to the back end, get it out there for you. Otherwise, tune in this afternoon. I'll be over on the 5x5 network. You'll be able to tune in, see us over there. We got the full Wednesday lineup, and we'll see you back then. Take care. God bless, everybody.